Hi, Jamie Davis here from the ANIA Conference 2016 in San Francisco, here for the Nursing Show, and I'm really excited to be talking to Si Luo from Patient Safe Solutions, one of the vendors here in the exhibit hall. There's a lot of great information and resources in there for you. If you're not at this conference this year, make sure you attend next year. But Si, before we get into what you wanted to chat about, tell us a little bit about your background.
Sure, thank you. My background started in biomedical engineering, doing a lot of the things on the science side. Actually started with a DNA sequencing company based out of San Diego. Out of a random chance, got involved with the healthcare provider side with Patient Safe Solutions. Joined them in the founding days around 2010 timeframe and started shadowing nurses, nursing informaticists to design mobile workflow for them in order to live in a better future that way.
And we've talked a little bit with one of your colleagues from Patient Safe Solutions a little bit earlier in another video segment, so look for that. But you wanted to talk about specifically the nursing informatics profession.
Yeah.
Why do you think it's so important that we really highlight this profession?
Absolutely. Since the founding of the business, we work with a lot of CNOs, CNIOs as an emerging profession really in the last 2 years or so. What we found is it's a wide spectrum of professionals. There are super professional users on the nursing side that are so good at deploying the EMRs, designing the workflow, and fighting all the challenges that are inherent in that process as well. And there's the other side that sort of came from the academia side, more canonically trained in medical, nursing informatics, and clinical informatics that way. Yet all of them bring different perspective to the space. In this post-EMR world, if you will, nursing being the largest workforce in the hospital setting and still has a huge impact on quality, workflow efficiency, and the end user satisfaction with their care environment, has wide-reaching impact. But we think that this profession deserves even more attention and more seat at the table, if you will, to drive decision across workflow, quality, and general improvement across the space as well.
And it's so important. I mean, we try to get nurses more involved in healthcare at all levels and all areas. But the nurse informaticist, I think, is really key as we continue to drive more and more technologies into the patient care space.
Absolutely. And I think they sit in this interesting cross-section where they had experience practicing at the bedside. They understand the user's psyche in addition to their initial reaction to the earlier era of the technology that we adopted. And because of their inkling, because of their bravery, they chose the nursing informatics profession. I think they can really be a key stakeholder across patient safety decisions, workflow design decisions. And now EMRs are 90% completed. What do they do with the interesting technology that are about to come into the hospital to improve healthcare in general, improve their work environment, and do something even more meaningful going forward? I think those are all the things that we're very much looking forward to for this profession to grow more and more in the coming years.
Well, Si, thanks for chatting with me. Is there some place people can go and find out more about your company if they want to look online?
Yeah, and absolutely. They can go on our website. I'm sure you can find it on ANIA's vendor sponsor page as well. It's patientsafesolutions.com, and we'd love to have conversation with nursing informaticists all around the world about what's important to you and what we can do to help your profession develop even more and more in the coming years as well.
Well, Si, thank you very much. I appreciate it. And I want to thank all of you for checking out this segment here at ANIA 2016 here in San Francisco. If you want to find more videos like this one, you can check them out over at ania.org as well as over at my site, NursingShow.com.